Hi, my name is Aaron Gerds, and I'm with the Cleveland Clinic Taussig Cancer Institute, and I was one of the investigators on the PERSIST-2 study. Today I'll be talking about the late-breaking abstract on the PERSIST-2 study that will be presented here at the ASH annual meeting. Myelofibrosis is a disease of the blood and bone marrow and has a hallmark of low blood counts, and this is a particular issue for many patients, particularly low platelet counts. In fact, roughly a quarter of patients, 1 in 4 patients, will have a platelet count less than 100,000, and about 15% or so of patients will have a platelet count less than 50,000. Having low platelet counts increase your risk for bleeding, which is a serious complication of this disease. Also, it might limit the treatments that we could potentially use for this disorder, namely drugs like hydroxyurea or the drug ruxolitinib, which also improves spleen size and patient symptom burden. But again, one of the main side effects of these medications are lowering platelet counts, and you already have a low platelet count. It's difficult to deliver these therapies to make patients feel better and potentially live longer. So the PERSIST-2 study really focused in on this population and used a newer JAK inhibitor called Pacritinib to treat these patients. The study enrolled around 300 patients, and it was a randomized study, randomizing patients from daily dosed Pacritinib to twice daily dose Pacritinib to best available therapy. So it was a 1-to-1-to-1 randomization study, and then looked at the outcomes. The primary outcome really looked at combined Pacritinib versus best available therapy. So both the BID and daily dosing were combined into one group to look at the primary outcome. And the primary outcome was actually a dual primary outcome, looking at both spleen reduction and symptom burden reduction. The spleen reduction was a 35% reduction in the spleen volume, as a threshold for a positive result there. And for symptom burden, at least a 50% reduction in a patient's total symptom score, which is a form a patient fills out listing the different symptoms and the severity. So this study completed enrollment, and the top line results are available for review now here at this late-breaking abstract. And really the main take-home point is the efficacy outcome of spleen reduction and symptom burden reduction. And we saw that 20% of the patients on Pacritinib had at least a 35% reduction in their spleen volume, compared to best available therapy, which was roughly in the 3% range. So there was this difference there in spleen reduction in these patients. I think it's important to note that in the best available therapy arm, roughly 45% of the patients received ruxolitinib as best available therapy. For symptom assessment, symptom burden, the results were still impressive, but not statistically significant. So there wasn't a statistically significant difference in the number of patients that achieved at least a 50% reduction in their total symptom burden scores. One of the important issues with this medication is the safety profile. And the safety data is still being gathered on this medication and being compiled along with the results from the PERSIST-1 and earlier studies with Pacritinib. The FDA put a hold on this, the development of this drug back in February, and due to a concern of increased deaths and cardiac and bleeding complications in this patient population. And so the safety data will be really important, not only in this study, but aggregate across all Pacritinib studies as this drug is being considered for further trials or perhaps to move closer towards the market. And really we need to understand the benefits versus the side effects in this population. But I think one of the most important things about this is again, is an area of need. We have a JAK inhibitor already for many patients with myelofibrosis, but for these patients who have lower platelet counts, ruxolitinib may not be able to be given or may have to be given at a reduced dose. And so it's important that we have new treatments in this area. I'd like to thank everyone for listening to this presentation on the late-breaking abstract regarding the PERSIST-2 study, oral Pacritinib versus best available therapy in patients with low platelet counts and myelofibrosis.